Hey everyone, welcome to First Aid AMC MCQ. Are you guys able to hear me properly? There is no problem.
Clear.
Good. All right, so thanks for joining us today. So today we are going to do the AMC introduction session. I am Dr. Arshan. I am one of the mentor and also a co-founder of First Aid AMC. And it's really good to see all of you again. Many of you are already our student for the last few months. And I'm extremely sorry for delaying the course this time. I'm still recovering from a sudden illness that I got, and with all of your prayer and also definitely your patience support, I've been recovering quite nicely at the moment, and I should be able to continue your classes and everything. But again, I really appreciate all of your patience, support during these last 2 months when we had to delay your course. And I know that most of you are already our AMC MCQ student. You have been enjoying the student portal. We have given you full access of the last batch portal so that you can start your preparation and you don't need to just sit for these 2 months. I hope that was helpful for you, right? And now you are actually kind of a pro. You're not a beginner or immature anymore. So it's going to be a fun to teach a batch like that because we have never done this before where students already got access for 2 months. So you will know a lot of things if you have been into our portal, and hopefully you were not wasting your time. And I hope that you guys were going through all the theory classes that you have got access to. So just a little bit of introduction of myself, and then I'll introduce about first aid, and we will introduce how to start your preparation. Now, many of you did this class. When I took the class, I believe in end of May or early June. So if you have done this class might look like a repetition. I'm sorry for that, but because we're starting this course again, like as a new course, I want to start from scratch. Many of you did not do that intro class, and intro class is really important part of your preparation. So I want to start from scratch, make sure everyone is on the same page, and then we can go from there, right? So I am Dr. Arshan. I'm one of the, I, I've been working in Australia for the last 8 years, and I worked in hospital system, and currently I'm working as a general practitioner, and also like I have worked in almost all the healthcare systems Australia has at the moment. So I've got a good knowledge and experience about how the health system work here. And given I'm quite updated about how the guideline is changing, I'm quite updated about what AMC MCQ questions are, how the questions are getting changed, because you know that this this is the year they have advised that the questions will be a bit difficult from the previous batches or previous years. And it's not just your batch, the January batch that we have finished, we changed a lot for the course to cope up with the new difficulty level of AMC MCQ. And also like we have added a lot of topics in the last batch, and definitely in your batch, given I have seen a lot of questions which are quite new in AMC MCQ history. So I have seen some of the questions are quite difficult, and some topics which usually a specialist level kind of topics, they are giving it in your exam, and we will incorporate all of those into your course as well. Okay, even though you might have done the theory classes for the last batch, but there will be a lot of changes when I take the class again. Might be like definitely theory will not be changed fully. Theory remains more or less the same. But again, anything that is new, anything that has been coming in exam, I will try my best to include in your course as well. Now, about first aid, all of you know that first aid AMC MCQ is the number one AMC MCQ preparation in Australia and also overseas. We have students from all over the world, and we are proud to share that almost every month we get the highest number of students who pass AMC MCQ. And we don't have any competition, or we don't have any other courses which is comparable to us. And if you have done any course, or if you have seen some of the materials, I believe you will understand the level of standard that we maintain for AMC MCQ preparation. And all of our doctors, all the mentors that's going to take your class, they are currently working in Australia. None of them are students, none of them are like overseas doctors. Every one of them has to work in Australia to become a mentor in AMC MCQ. So they have updated guideline about how Australian health system works. They have updated guideline about AMC MCQ because they have been doing the question solve or recall solve sessions for years and years. Okay. So you are in the right hand, and I can assure you that if you follow what we are showing you and what we are guiding you to follow, you will pass this exam in your first attempt. Unless you become really unlucky, or you don't prepare well, and then with 40-50% preparation, you go for the exam. That is not our fault because you did not prepare well. So if you prepare well, if you finish everything that we are showing you, I can be 90% sure that you will pass the exam. 10%, I can't, because we never know. And that is the right percentage, I should say, because I should not say that 100% will pass the exam. It's going to be a lie. But definitely from all the statistics from the course that I have seen over the years, almost everyone pass the exam. If they are hardworking, if they follow the guideline, if they come to the live sessions, I see that they pass faster than people who just do a recorded session. I also see that people who do a lot of recalls, question solve, have some study partners, they pass this exam much easier than any others. Okay. So let's start then. And I know you will have a lot of questions. We will have a question and answer session at the end of today's session, and I will allow you to unmute yourself and ask any question that you like. In the meantime, during the sessions, if you have any question, especially about the things that I'm discussing, you can always write it in the chat box. All right? So how are you guys feeling at the moment? I always want to ask this question, that this is going to be your first class of your AMC MCQ journey with us, and you all have a lot of dreams. You all have that dream in your mind, in front of your eyes, that this is how I'm going to start my preparation, and one day I will become a doctor in Australia. And I get to see a lot of students who pass this exam, and they come here, they become a doctor in Australia. It's really good to see when I see that a lot of you over the next couple of years will start working in Australia. And that's how we normally get our students, because like you guys, once you pass the exam, usually our students share the feedback, our students share the experience that they have with us. And that is the only way you guys also know about First Aid AMC. So as a mentor and also as a doctor who have been working in Australia, who have been trying to help the IMGs for a long time, I can assure you that you have chosen the right path and right journey, because the number one problem in this journey is going through multiple things, going through multiple courses, and going through things that is wasting your time. But all of you who are here today, you are in the right journey, you're in the right path, and 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 I can assure you that there will be no waste of time. I don't waste time during the course. I don't waste time by talking about myself or talking about course a lot. You must know about that, because I will not ask you about your personal things. I will not ask you about how your life is going on. With you, my only experience is going to be making sure that you pass this exam in your first attempt. And that's it. Okay? So just to motivate you a little bit, because always I see in various Facebook or other social medias that there is a lot of negative energy about AMC, MCQ, or the complete AMC package, that one, is Australia worth to come as a doctor? It is worth. If any of you ask me that is it worth to try for Australia, yes, it is definitely worth it. If you are trying to think of UK pathway like PLAB, please do not do that, because PLAB is oversaturated at the moment. Even my friends or my colleagues or even my, like, a lot of juniors, they have passed exam like PLAB long ago. They could not join as a doctor under NHS. So it is not a good idea anymore. Yes, 5, 6 years ago, PLAB was one of the alternative of AMC, but now it doesn't stand. Okay. So please do not think of like, I'm going to give PLAB first, work in UK for a couple of years, and then I'm going to come to Australia, because I think that AMC is a bit difficult. It's not the case. If you can pass PLAB, you can pass AMC. Okay. So it's not that difficult if you have a good mentor and a good guideline. So, and yes, USMLE, definitely. I also like USA is also my favorite. If you want to go into that pathway, please go for it. But I would say that it's either go for USMLE or go for AMC. That should be your two choices. Okay. Now, if you are doing the AMC, MCQ, your first step, and then you might know already that after you pass MCQ, and if you give your English exam, then you can apply for job. And many of our students come to Australia just after passing the part one. Okay. And then while you are doing job in Australia, you can appear the part two. So that is really helpful to get a job even after part one. It's not like very common, like it's not readily available that you will definitely get a job after part one, but many people, they get job. I even, like, one of my study partner, when I was preparing for AMC, which was long ago, she got the job. So she got job after part one. So it is not impossible. And nowadays there are more doctors Australia is asking for. So it is much easier to get a job after part one. So right now, all you should think of is passing AMC MCQ, nothing else. Don't think of job, don't think of part two, don't ask anyone about Australia anymore. You have already chosen a pathway, you have already made a decision, stay with it. Okay, because there will be a lot of negativity around, like, everyone. It's a kind of a myth which has been going on for years and years. It's not just a new myth that getting a job in Australia is impossible. It is not. If it was impossible, how we are working in Australia, and how hundreds of IMGs are working in Australia. So if I give you the stat, almost 50 to 60% Australian doctors are IMGs, almost half of them. So it is not impossible. Now, to give you some motivation, this is our last year November exam candidates, and this is not the full list. So this was just like a part of our students who passed the last year November exam. And many of you who are doing this course, I know that you are going for November exam, right? I will try my best to finish everything by November, to make sure you are well prepared by November. Although the course will run till end of December, because we might need to cover few things, especially the recall classes or question solve classes. That will be till end of December, but the theory classes and everything else which is necessary to pass your exam by this year, I will finish everything that is needed, and I will guide you so that you can definitely prepare for this year. And if you're not preparing for this year, your exam is early next year, then you don't need to worry at all. Okay. And that was the 2024 past candidates. So, and if you have seen our First Aid AMC MCQ Facebook group, you can see that how many students pass exam every month. you can scroll through that group and you will see a lot of feedback, a lot of past candidate feedback that you can read, which is also motivational. You can see that, yes, there are people who are passing the exam. And we always try to congratulate the students who are passing the exam. Most of the students come and say that, Dr. Arshan, thank you so much. But many don't. But we get at least half of the students who pass the exam. They come and talk to us and say thank you. So the amount of student passing from the course, you are just seeing the half of it, and half of it we don't even know that they are passing, because in one of the because we only run two courses in whole year, and we try our best to make it highly standard for AMC MCQ. A lot of students join the course and a lot of students pass the exam. Okay, so don't feel like, oh, there's too many students in this course. There is a reason why there are too many students, because we only have two courses in a year. And we see that half of the students usually they can't join the live session, they do recorded session. Now, even if there is 500 students in my class, if 500 students ask questions about it, I will always answer those questions. You will always find out that I never skip any question. I will skip if you ask some stupid questions or irrelevant question. But if you ask relevant questions, which is important for exam, I will never ever finish the class without replying that. So we always make sure that your questions are answered. Doesn't matter how many students are there. All right. So, and it's going to be an interactive session always. It's not just I'm going to talk and talk. And same goes with any other mentors. This is the MCQ course looks like. So today is your trial session with me. So this class is not about learning MCQ subjects. I don't think we will get enough time to start any particular subject or topic. Although if I will start a bit of a psychiatry. But if not, today's session is about understanding MCQ, understanding how the course is going to help you. And then we will start our course from now, although it is written 15th of August, we're starting from 14th of August. So 14th of August, which is, I believe, next Friday, that's when we will start our free 2-week sessions. The free 2-week sessions, we will start with, first, we will start with question solve tips and tricks. Like you will get an idea about how questions appear in the exam and what are the traps, what are the tips, how to solve questions. So that will be your first class with me. And then we will do cardiology sessions. So we always finish full cardiology in these free 2-week sessions, which will be free for everyone. And definitely this is part of the course class as well. All right. So if you look over here, so your trial class is happening right now. That's definitely, the course, although it is written as 15th of August, official is 15th of August, but we will start your classes from 14th of August, which will be Friday. And you will get the 2 weeks free sessions. I have already created the schedule. It will be uploaded tonight after the class. So you'll get the whole 2-week sessions schedule in our Facebook group. The course as a whole, it covers everything that you need to pass the exam. You don't need to do anything extra. So the theory session will be completely covered by me, and I cover almost anything that can ever come in exam. So theory will be extensive theory sessions. Along with the theory, side by side, we do recent exam-based question solve. So every week, along with the theory session, there will be question solve classes as well. I'll go through all of this with you later on. So let's talk about the course structure. Now, before I go into the course, I want to talk about AMC MCQ a little bit. And then at the end, I will come to the course, how the course gonna work, what is the structure of the course, each and everything. And then you can ask questions about the course. There will be much better flow about this class, okay? And it will be a bit of a change. Let's talk about AMC MCQ and then we can come back here. All right. So AMC MCQ exam. So AMC MCQ exam is a computer-based, computer adaptive, software-based exam, which means that you can't appear the exam from your home. You have to go to an exam center to appear this exam, and it is a computer adaptive exam. So the first thing to understand about AMC MCQ, that it is a multiple choice question. There are 150 question, and in 150 question, you have 3.5 hours to finish this 150 question. Okay? Now, the total mark for this 150 question is 500. Out of 500, if you can get 250, you pass the exam. This is how the exam AMC scale looks like. So it is a score from 0 to 500. If you are on that 250, you pass the exam. And hopefully all of you will get that. Now, you might think that how 150 question has been marked by 500. How does it happen? We don't know. No one knows about the marking because every question in AMC MCQ, there is different marking. Some question can carry only 1 mark, some can carry 2 mark, 5, 10 mark. No one actually knows how this marking really works. Sorry, someone's microphone is on. Okay, I'll keep all of you muted for now just to make sure there is no background noise. So I was saying that no one knows how this 500 mark comes from. So, but we know that there are some questions in the exam which will be difficult. Some question will be moderately difficult. Some question will be very easy. The easy questions usually carry small marks like 1 or 2. The more difficult the question is, the higher the mark is. So the problem is you don't know the mark because the exam questions, they don't usually write in front of the question that this question carries 10 marks. So no one knows the marking. So each questions in the exam is equally important to you. Now, one of the things that we know that out of this 150 question, there are some questions which are pilot question. Okay, so we know that almost 30 questions are pilot questions, which does not give you any mark. Again, you don't know which questions are pilot in the exam. So that means each question is equally important to you. Sometimes we have an idea that if a question is really big, super difficult, never we have seen in any of the past recalls, that is usually a pilot question. Okay, that's like a general idea, but again, there is no one way of finding out that which question in your exam is a pilot question. So each and every question in your exam are important. So if you have 3.5 hours, which means we have 210 minutes. So for 150 questions, you have 1.4 minutes for each question. So you don't really have a lot of time. There are questions which can be quite big in the exam. And there are questions which can be really small, like 1 or 2 line question. So it is a kind of an integration, kind of a blinded question pattern where some questions are really large, some questions are quite small, so that you can manage your time. The important thing to understand is that you can't sit and think about a question answer for a long time. Let's say you wasted 10 minutes for a question. That is a problem. You will not be able to finish the exam. And if you can't finish the exam, your exam result can be withheld, which means your exam will come as a fail. Okay? So I advise everyone that it is a good idea to try to finish each question within 1 minute. If you want to go a bit more, then 1 minute, 10 seconds. That's it. You should not waste more than that, because at the end of the time, at the end, you will not be able to finish your exam. So when you are preparing for your exam, when you are doing all the software-based mock exams in our portal, make sure that you follow this pattern, that you're only using 1 minute, 10 seconds for each question. Okay? Because you will have a countdown, or you will have a stopwatch on the right-hand side, even on the exam software. You'll be able to know that how much time you're wasting, or how much time you are needing for each question. So that is important, because finishing the exam is really important. If you can't finish, you can't pass the exam. All right. I can see that many of you have questions. So if you write it down in this chat box, I will answer them later on, but I will just continue discussing about it. Many of your questions will be answered during my discussion anyway. Okay? So don't take it personally if you find out that I'm not answering your questions. It's not a time. I haven't started answering any of your questions just yet. I'll answer them. All right, so we are talking about the AMC MCQ exam format. So 150 questions, 500 mark. If you get 250 out of it, you pass the exam. 3.5 hours, you get 1 minute, 24 seconds for each question. Okay? Now, we were talking about software-based exam. What is software-based exam? Software-based exam means AMC has a long collection of questions. So they have a Q bank, and that is their software. So in their software, they have thousands of questions, and every one of you will get 150 questions from that vault of MCQ. It is an adaptive software-based exam. So if everything written in here, there is a meaning for it. What is adaptive means? Adaptive means how you answer your questions, the software will adapt according to that. Which means, let's say that you went for the exam. This is where you are sitting, and that's where the another person is sitting. So there will be, let's say, 20 students who is appearing the exam in an exam hall. Each and every one's questions will be different. So if you think that, well, let me have a look at what the other person has answered in the first question. This question and this question is completely different. So that's why we call it adaptive. So let's say that the software will give you an easy question. The first question is easy, so you got it right. So easy question might carry 1 mark. So software then give you a slightly difficult question, and you got it right. Every time you get it right, the software will adapt, and it will give you a slightly more difficult question. Until you get one question wrong, the software will again go back to the same pattern of easy, moderate, difficult, and then very difficult. So this is how the exam software will work. Everyone's question will be different based on how they're answering their questions. So please do not rely on anyone else's answer in the exam. That's really important. That's why sometimes we find out that many students who say that their exam was very difficult, they usually pass the exam. And I have seen students who just say that it took only 1 hour for me to finish the exam, and it was really easy. I see a lot of time that is the student who failed the exam. So getting a hard exam question, it's not a bad thing. So if you're getting a lot of hard question, it means you're doing really good. That's why computer is giving you more harder question. So, and harder questions always going to carry more marks. So if you can get some of those harder question right, then the chance of passing the exam will be very high. One of the other important thing is the last 30 questions. So we believe, or like AMC actually in their specifications, they mentioned that the last 20 to 30 questions. So there is no specific number, but we believe that definitely last 20 questions, they carry the highest marks. And most of them are mastery questions. So there is a term called mastery questions. Mastery questions means that you don't want to answer wrong. So these mastery questions are common things, like a patient who comes to you with chest pain and you are considering myocardial infarction. What you want to start this patient with? You always want to, your first thing is to start aspirin for that patient. That is something every student should know. So something which is very common, something which no one should miss, something which is life-saving, those are mastery questions in the exam. And every subjects, like your medicine, surgery, pediatrics, will have some mastery questions in the exam. You don't know because, again, same thing, no one knows. Those mastery questions carry high marks, and if you miss those mastery questions, then software usually, most of the time we see that you will fail the exam. If you miss most of the mastery questions, somehow the software fail you with 249. I've seen a lot of students who fail in the mark of 249, just marginal fail. This is the group of candidate who most likely they miss those mastery questions. Okay, so it's important to know the common things, and in the course we will definitely cover the common things that can be the mastery questions, which is frequently coming in every exam. So don't really worry about that. So we're talking about the last 20 questions. The last 20 questions are high yield questions. So that's why we want you to have some time at the end of the exam so that you can take some time to get those questions right. You don't want to get those questions wrong. Okay, so that's important. Now I'm going to talk to you about how the questions appear in the exam and how really the exam is going to work. So what is the technical part of the exam? Let's talk about that. So are you guys with me so far? It's making sense? So this is AMC specification. This is where they have talked about the computer-based adaptive exam. Let's have a look. So this is the AMC CAT examination user's guide. So it's very good thing. So you can see here, so 120 questions are scored questions, which means that 30 questions are pilot questions, and you get 3.5 hours. 150 questions, type A. Type A questions means that out of 5 options, you have to choose only one answer, and only one answer is correct. There might be multiple answers or options which might look normal, which might look the correct answer. It is right that one question can have several right answers, but it should be always the best answer out of that 5. So remember one thing, that it is always only one option which is correct. And even if a question has multiple answer or multiple possible right answer, you have to always choose the best answer. Okay? So it is important that you can't argue that, well, this patient's let's say a diabetic foot ulcer patient, and the question is about management. For a diabetic foot ulcer, yes, taking a swab from the if it is an infected wound, taking a swab is correct answer. Giving antibiotic is a correct answer. Managing the diabetes is a correct answer. So all of these are possible correct answer. But what is your best answer? That is important, and that's what you need to choose in the exam. It's not about just choosing the right answer. It's about choosing the best right answer. So you should know about the few logistics about AMC MCQ. So not every country have AMC exam center. So we know that India has got one. India has got multiple exam center, and then I believe so. India, Thailand, Singapore. I I thought like I know Pakistan might have one, which I'm not sure which is at the moment working or not. If any of you are from Pakistan, you should know. Kenya has one, okay, so that's good to know. So most of you who are in the Southeast Asian region, your exam center will be either India, Thailand, China, or Singapore. Yeah, so there is one of the exam center working in Lahore, so that's good. So you have got multiple options. Now, so you should know that if your country has exam center, that is the first thing you should search. Because if your country doesn't have an exam center, then you need a visitor visa to go into that other country who has the exam center. So you need to talk to a like usually those visa people or a migration agent or visa lawyer, someone who can help you with this. If you have never done this, it's quite easy to get a visitor visa. But if you've never done this, that can be quite complicated and it can take some time. So you need to talk to one of the migration agent or one of the visa people who can arrange this for you. Now, to appear the exam, it's not that just you got the visitor visa and you can just go for the exam. You need a registration number. So we will talk about that in one of the orientation session about like the few more details about it. But the first thing you need is a AMC registration number. And to get a AMC registration number, you need to create or you need to verify your MBBS certificate through ECF-MG. Nowadays, they have changed the total thing. So now it's Intel. So through Intel, you will need to verify your MBBS certificate. And once you verify, and also you need to create a Epic account. So we'll talk about that. Please do not get overwhelmed about all of this. It's easy, but when you hear about this, it becomes really complicated. So basically, to get the AMC registration number, because you need the number to register for the exam. So to get the registration number, you need an Epic account and you need to verify your MBBS certificate through the Intel or through the ECF-MG, which all online nowadays. There is no other, like previously it was quite complicated. Nowadays, everything can be done online. Even the notary cam and everything done online. So it's quite fast, quite easy nowadays. We'll talk about that in the course. Once you get your registration number, then through the AMC MCQ website, so there is a website which is amc.org.au. This is where all the AMC related topics like your results will be published there, your exam registration will be there, everything is there. So through that website, you will be able to register for the exam. AMC MCQ happens every month except in December and January. So except that all other months there is exam and there are a lot of exam seats. So you don't need to worry about like, well, I'm not going to get the exam seats. Usually everyone gets. There are a lot. Unlike AMC Clinical, where people need to wait for a long time to get an exam seat. So once let's say that you have prepared for the exam, now you are ready to register for the exam. So I advise that at least when you are in the 50% preparation zone, start thinking about registering for the exam. Because once you register for the exam, let's say even 6 months before your exam preparation will be so fast and so smart, because now you are in your head that I have already wasted that much money on it. I have already gave my money. I have to pass this exam. So your exam preparation becomes so good if you register for the exam. So my advice that 6 months before, so your 50% preparation is done, you think of registering for the exam. 6 months ahead, register for it. Once you register, you usually get a very good pace of your exam preparation, okay, which is really important. Now, excuse me for that. Okay, so once you got your MCQ registration, and then let's say that your exam is 21st of November. Just let's assume. And so definitely if your country doesn't have the exam center, you have got your visa, you have done everything right, everything is done, you have booked a hotel nearby your exam center. Those those little tiny things, we will talk about that in the course, but this is just like a bit of an idea. Then once you go into the exam center, there is a ID requirement. So this is where a lot of time candidate gets into problem. So you need at least two ID, which they can verify. The best one is if you have, definitely you will have a passport, so that will do it. If you have a driver's license, that's really good idea, because that's universal identity verification. Many of you will not have a driver license, then the other option will be a bank card. Now, bank card is the problem one. I've seen a lot of posts about problem into that bank card. So bank card, if your name is on the bank card and you have signed the card, that usually works. But if your name is not on the card and there is no signature of it, then usually it will not be counted as a verifiable document. Because if your name is not on the card, that card can be anyone else. How they can verify you based on that? I hope you understand their point of view also. Okay, so these are some of the ID documents that they will ask for. So without two verification document, you will not be allowed to appear the exam. Okay. Once your ID is verified, then they will take you to the exam room, and there will be a multiple computer, and they will ask you to sit in front of one computer. There will be a pen and a write board where you can write if you want, and you can make notes. Usually, making notes waste time. Unless you really need to do some math, usually for statistics, you don't need to use this writing board at all. Two IDs. So you need valid passport, definitely not just a valid passport. You need two verification documents. You need a valid passport, which should not be expired in the next 6 months. And then you need another verification document, which can be driver license. Definitely it needs your name on it. The driver license usually doesn't need a sign. I have not seen a driver license where there is a sign, but if your country needs a sign, then yes. But driver license will have your name on it, which is all that they need. And then if you don't have the driver license, then a bank card where there is your name on it. Okay, so your name must be on the card for it to be used as a verification document. Okay, now let's talk about, this is how, so once you're in front of the computer screen, the computer screen will look like this. Okay. After that, see that there is a next button there. So you click on the next button. They will take you to this non-disclosure agreement. And you will read all of this. And you will always need to say, I agree to this agreement. If you don't agree, you will not be able to appear the exam. Once you do that, then they will take you, excuse me, sorry for that. So once you agree, on the second screen, there will be some tutorial or practice question. So practice question doesn't get any mark. It's just to give you the idea that how this software works. So you can see that there is time remaining over there. So you get 10 minutes to finish these practice questions. So just choose any of those. Once you have done that, so once you click on the next button after reading the screen 4, a ready to begin exam box will pop up. Okay, so you'll have like few questions. So you can see here one question. So basically 2 questions, which are tutorial question. And once you have done that, so you can see that there is a next button there. So you click on the next button, and then they will say that this is your AMC exam. You will have 3.5 hours to answer all the questions. So they'll give you some idea. Then this box will appear that, are you ready to start your exam? If you click yes, then your exam will commence. Now, few things I wanted to show you, which is really, really important. Let me show you one of the question answer. So let's say this is your actual exam question, the first question in your exam. Okay, so you have clicked that, yes, I'm ready to start the exam. Your timer has started. And then this is your first question. The important thing is that if you want to go to the next question, you need to choose one answer. Okay? Once you choose an answer and you go to the next question, you cannot come back anymore. There is no previous button in the exam. Previously, there was option of going backward. Previously, you could even flag the questions which you are not sure about, and then at the end, you could come back to that question and change the answer. But now you can't do that. So it's very straightforward now that, let's say this is your first question. You have to choose one answer. So let's say you choose this one. But if you did not go to the next page, you can still change your answer if you want. But once you have clicked next and the question has been changed and you got your second question, that's it. The software has registered that answer. You can't change it. You can't come back to it. Nothing. It's done. Very important to understand that. And if you don't choose anything, the software will not allow you to go to the next question. Okay? So in this way, your 150 question will be finished. Once you finish your 150 question, let's show you this. When you reach the last question of the examination, you can finish your examination by clicking on the End Exam button. That's one of the important things. That's on the left lower corner. If you don't, let's say you finished 150 question and then you did not click on End Exam. Until you click on End Exam button, your exam will not be registered and the software will not be able to mark you or finalize your score. So it's very important that just because you finish your 150 question, don't just come out of it. Usually, the person who is looking over the exam, the invigilator is supposed to check all of this, but sometimes they can forget. It's your responsibility to know about this. So when you finish your 150 questions, make sure that you click on End Exam. Okay? Once you click on end exam, then you raise your hand and the proctor will come and make sure everything is right. Okay, that's it. That's your exam. I hope it made make a bit of a sense. Remember, there is no negative mark. Okay. Now I would like to know, so before I go into the course structure, now I would like to answer a few of your queries and then we can come back to this again. So let me see, there are some questions that you guys have asked. Let me answer those. So Iqbal, you asked earlier in this class that is it enough what you will be discussing in this course to pass the exam? Yes, it is enough. Can we pass the exam with your theory lectures? Not only theory lectures. Remember, AMC preparation is, is a combination of theory plus doing our question solve session as well. So your exam preparation is 50% based on your theory knowledge and 50% based on your question solve experience. Okay, and question solve tactics. So we do all of them in the course. Every week you get theory classes, you get question solve classes. So together, yes, if you finish everything, that is more than enough to pass the exam. Lecture notes, lecture videos are not downloadable. No course do that. If we do not work in a hospital during preparation, will it affect our exam and getting a job after? Not your exam. Exam doesn't like your exam doesn't know whether you are working in in the hospital or not, but it can affect to get a job after an exam because having a recency of practice is important. So if you are not working for a while, then usually getting a job from overseas will be difficult. So my recommendation is that please do not quit your job, continue your job, maybe take less duration shift. Do not take those 16-hour shift anymore. Take maybe 8-hour shift, finish your day, maybe even lower down your days, maybe 2 or 3 days a week, but do not stop it. Okay? It's very important that you continue working. It's really, really important for the job, not for the exam, but for the job. How about exam for November and December? There is no December exam. Yes, if you now if you are a beginner, then November is too early for you. That's the honest feedback. So it's middle of August. You have 3 months. That's not enough for a preparation. So, but if you have already started, let's say the last 2 months you have done all my theory classes, you have finished the recorded theory section, then yes, you can. But if you are beginner, you haven't done much, no, please go for the next year exam. Yes, definitely. Rupankar, Dev, Arnav, this is the course for, this is the course that if you are going for exam next year, let's say February, March, April, May, even up to June, this is the course that you should join. Okay? Because your preparation will take at least 6 months. So my advice that please do not go for your exam before 6 months of preparation because it's the minimum time someone who is working to give to this preparation. Without 6 months preparation, especially if you're working and you have your family life, other life, it's not actually a possible thing to do. Once you start your preparation, you will understand. No month is difficult. It is a myth. Remember, we get a lot of students who pass February exam, July exam. Those are all myth. Please do not go with that. If you want to keep hard copy of any book, that will be John Mortag. We provide all the soft copies of any book that you will require, and you get all the materials in your student portal anyway. So you really don't need one. But if you are a hard copy person, then yes, get the John Mortag book because you will read the John Mortag a lot during the preparation. Apart from that, you don't really need anything else as a hard copy. So if any of you do not have the medical certificate because you did not get your medical certificate yet, then the other option is to register into the course. You can share your final professional exam certificate. So you will have a final professional exam certificate that will be enough. You got your answer that no, you can't go behind. Yes, it is. We always follow the recent AMC guideline. The guidelines that we will be giving you in the course, that will be mainly focused on therapeutic guideline, which is the most updated guideline, RSCGP guideline, and also John Mortag. So everything that we will share in the course, those are updated according to the year. So every year, anything that is getting updated, you will get the updated version of it. Yes, definitely. Your portfolio doesn't matter to join a course. The AMC portfolio is needed for appearing the exam. Okay. So yes, you should enroll the course irrespective of whether you have AMC portfolio or not. We do not require your AMC portfolio. Bangladesh do not have exam center. There is no, yes, there should be exam in November, Hamad, but no exam in December. Yes, this is a recorded session, so this class will be uploaded into the Facebook and also YouTube. Dr. Savera, no, exam is not tougher in February than any other months. If any of you want to unmute and ask questions, feel free to do it now because you will be able to unmute now. I just allowed that.
Hello.
Yes. Who is this?
I am Dr. Dipayan from Bangladesh.
Yes, Dipayan.
I have completed my graduation in 2015 and then later period I joined in surgery department and completed my post-graduation training there. I have a valid certificate of 4 years experience in surgery, but at present I am not attached to this medical college. Is it countable for getting job after passing the exam?
Yeah, definitely. Any experience that you had, it is countable, but it's mainly about having a recency of practice. Recency means that when you are applying for a job, are you working at that moment or not? That's what they usually look at. If you have significant clinical gap, you have to explain why you had that gap. And they usually do not like to have a gap. Okay, but if you have gap, it's not like there are a lot of doctors in Australia who who came Australia 10 years ago and definitely did not do anything in between. They can go back to health system. They have a 10 years gap. But the thing is that it becomes a bit tricky. So you have to cover those gaps by doing some CPD courses and also showing that yes, you are doing something to cover that gap. Okay, so having a gap is not end of the world, but it's best not to have the gap.
Thank you very much.
Thank you.
Hello, sir.
Yes.
Hello. Sir, Aisha from Bangladesh.
Hello. Yeah.
I want to know if I want to buy hard copy of John Murtad, which edition need to buy?
9th edition.
Thank you, sir.
Thank you.
Hi, doctor. How are you?
I'm good. Thank you.
I'm Shedruti. Actually, my question is that percentile test MCQ?
Not really. It's not a percentile kind of thing. It's kind of a thing like, again, no one knows how they really mark it. It's not like percentage, like how much percentage you have got, but it's about that getting the 250 mark out of 500. It doesn't work as a percentage. And
Actually, my question is like if I sit more than once, then it will negatively impact my next exam or something
No.
like that.
No, you
Oh,
can
thank you so much.
appear infinite times. I'm hoping that it will not be needed, but it doesn't count.
All right. Thank you so much.
Thank you.
Hello. So
Yes, I can't hear you properly, Arslan.
Mohammed Arsalan from Pakistan.
Yes.
Am I audible?
Yeah.
Okay. I want to ask, like, your first year AMC is providing 150 points. How much clinical gap will cover like that 150 points?
Good question. So any CPD is only countable in that particular year. That means if you do a course in 2026, it will be only covering that particular year. You cannot use this year course to cover your next year gap. Does it make sense?
Yeah.
And it means that it will cover one. There is nothing like 150 will cover 1 year gap. It doesn't work like that. It's about, for the requirement is that you have at least minimum 50 CPD point for 1 year. There's a lot of thing in the CPD, but the basic is at least 50 in a year. But you're getting 150. But it doesn't mean that that 150 will be counted as 3 years.
Okay. If I give exam in April, then I should have CPD hours for 2027 year.
Exam doesn't have anything to do with CPD. That's very important. CPD is only for work. When you apply for the work, and if you have some work gap, that is the time you need CPD. Otherwise, for exam, CPD doesn't mean anything. Okay, so it's a completely different thing.
But if I've taken the course in like 2026 and I'm applying for job in 2027, so the CPD hours for the last year will not be counted in 2027.
No. So they don't allow you to add any course which you have taken in the last year. So it's like it gets updated every year, the CPD. So if you, let's say you're doing a course in 2026, you can use this course only for 2026. And that's for doctors who are working in Australia also. We can only add anything that we are doing in a particular year. We can only use that course for that year. We can't use that course for the next year's CPD requirement. Okay?
Okay.
Good
Hello.
question. QBank, just 1 second, guys. So QBank, very good question. So at the moment, if you ask me which QBank to follow, I would answer eMedici is the only QBank that you need to follow. So we do not give you subscription for eMedici, but we will have lots of questions that we will take from eMedici and we will share during our question solve classes. That will be more than enough, but feel free to buy a subscription for eMedici if you want to. Okay? But yes, eMedici will be your QBank if you really want to go into a QBank. It's not mandatory, but a lot of our students do that. And a lot of time we see that they share some of the PDF version of eMedici. You can also go through that. So usually my recommendation, you really don't need to buy it. Usually you get it in different platforms anyway. And the question solve sessions that we are taking, that will be more than enough for your exam idea, that how the questions are coming in exam, what are the topics which is important. So that is more than enough. Previously, people used to do Amidex. If you want, yes, you can do that. You can solve questions from Amidex. Amidex is readily available in various groups. You can just do that. But when you go into multiple search, multiple researches, multiple things, it becomes confusing. So when we start your course after this 2-week session, we will give you a very good pathway to follow, that this is what you need to do, and that is more than enough. Okay? But again, we are not those QBank people, so we can't give you subscription for any QBank. That is legally not permitted. But some of those QBanks are readily available in everywhere. So you will easily be able to get it. So please do not worry about them.
Hello, sir.
Yeah.
Sir, from Bangladesh, I'm Rupam Kaur. My exam is on April, and I was asking about the exam week recalls that I have heard that helps a lot during my exam. So if the course ends at December, how am I able to solve the exam week recalls during April?
The November, we will have that exam week recall session. Only for November exam, we will do that this year. So you will not need to worry for that one.
And no recalls of our April exam because the course already ended at November.
Tell me again, what was that?
As my exam is on April 2027, so this course will end at December 2026. So how can I be able to do my exam recall for April?
Good question. So we have once our course is finished, we allow our ex-student to join our question solve course. So you will be able to join a question solve course as well, which has like very minimal payment for it. So we always do that. So you can, let's say if your exam is in May, June, July. So next year, again, there will be a course. So you will be able to join that, just the MCQ course, the question solve course. And in that way, you can get all the recalls. Okay.
So that means the exam week recall course also will be available. I can join in April.
No, there is no exam week recalls that we do like for April or for any other month except November. We only do for November exam week recalls, but all other recalls, we always solve it in each month.
Hello.
Okay, yes.
Will it be difficult to get a job if I have a 1-year gap after completing my internship?
No, it should be fine. Don't worry, because there is a lot of people like that. Okay. So job-related queries, we will not discuss it today. I will take a session on job-related queries. I always do that. So after we finish that 2-week free session, you will get a class on registration pathway and all this tiny little bit of confusion all of you have. I'll discuss that. Okay. So don't worry.
Okay, thank you.
Thank you.
Hello, sir.
Yes.
So this is Dr. Akhil from.
Sorry, Akhil, let me just unmute you. What was your name? Can you write it in the chat box? The name that is showing here. I can't hear you. I think if Akhil, okay. Now you should be able to unmute.
Yes, sir.
Yeah, tell me.
So being an old IMG from 2020, I was graduated in 2020, but I have no internship offered by my school, medical school. So, and I have been struggling with Indian license examination meanwhile. So now I'm ready to prepare for AMC. So will I be able to secure any internship position after passing AMC 1, sir? Like, will that be
Very difficult, Akhil. Very difficult to get an internship position in Australia because they usually get saturated with the doctors who pass from
Local.
here.
Okay. So I should be taking part 2 in order to get into the system.
Yeah, you should. My recommendation that like even if do you think you can get an internship in your country again? Is it possible?
They will be needing license for my country as well, sir. Hometown
Yeah,
license.
yeah. That is the only way then. Because I would not give you false hope that now again, is it impossible? Like no one gets internship? I've seen IMGs getting internship position. It's not impossible, but it is very, very difficult. So
Mhm.
I would not ask you that just to use that hope, because what if you don't get it, then you don't have any other choice.
Oh, so it's hard to find employer as a sponsor for internship.
Very, very hard.
Okay, sir. Thank you.
Thank you. All right, guys. So let's give it a break with your questions. I know you have a lot of questions, and I always get these kind of questions. Please do not ask questions related to job at the moment, because I want to focus on your AMC MCQ preparation. I know you want to know the full thing, and I know you want to have a vision in front of your eyes that like how am I going to work, because that's our end goal. But today's session is not about your job. Today's session is not about whether your job or recency is going to work. We will have an entirely discussion about it. There will be a session about it. So please utilize that class for this kind of question. Okay. Tonight, you learn about AMC MCQ. So questions that has AMC MCQ related questions, I will answer them. Anything related to registration or work, we will discuss that during that session. Okay. Let's talk about how the course is structured. And then again, we will have this question discussion session. So this is a 5 months course. The course is going to finish as official finishing date is 30th of December, but I will finish theory by end of November, or even I'll try to do it by mid-November. So I'll try my best to make sure that the theory is covered as soon as possible, and then you get more time to solve questions and all. The course is a blend of theory. Remember, if you have learned from some people who are misguiding you that just do 6 months or 12 months recall and you will pass this exam, that is very, very bad. So please do not think that any of the students who pass this exam, they just pass the exam by doing some question solve. It is not possible, and it is not the way to do it. Most of the students will fail in this way. So the exam preparation is a combination of a good theory knowledge, which is my responsibility. I will make sure your theory knowledge is perfect. And then also having enough question solve or enough recall solve done before your exam. So you have to have a combination of theory knowledge and at least minimum 12 months question solve to pass this exam. Okay. That's why we divide the classes as 2 classes in a week will be on theory, and you get 1 to 2 classes on question solve. So that you get a lot of question solve classes with our mentors. So the live classes are, so theory usually have 30 to 35 classes, and question solve we get at minimum 40 classes. So a lot of classes are there. And then you get a number of recorded class. So you get a lot of recorded classes because those recorded classes also is a part of your preparation. It's not possible for us to finish like 2-3 years of recalls. You also get to do few things by yourself, but the recent one, we will do it. So any of you who make the full payment, they also can get the last batch theory class. So once you make your full payment, and many of you who has done it like for this last 2 months, you got the past batch theory recorded. So all the theory that we have taken in the last batch, which is the most updated one, it's in your portal. Okay, so you don't need to wait for me to finish the theory class because it will be added into your portal anyway from the past batch. Yes, there will be some update in this theory class that I'm going to take. But again, It will not be entirely different. It's not like the full theory will be changed in 6 months, right? And this is the most valuable part in your portal. You will get access to around 300 to 400 classes that we have taken in the last 5 years. And that has got recorded classes and the questions solved. And that's like more than any QBank questions. So we have been doing this course for a long, long time. So for the last 5 years, the question solve sessions that we have taken, it will be also added in your portal. And it's already added, you must have seen it. Now, do you need to do all these 400 classes? Not really. But we give it to you. If any of you have time, you can do it. I strongly recommend that you don't need it. You at least need last 12 months. If you have more time, go for last 2 years. That's maximum recalls you will need to cover, not more than that. But you will get it in your portal. Let's talk about the theory classes, how we divide the theory classes, what are the guidelines that you will follow and all. So theory class we have, so I think we did not discuss one important thing. This was, what are the subjects? So these are the subjects of AMC MCQ. So AMC MCQ does not require any of those physiology, biochemistry, pathology. That's not what you need to know. The patient groups or the subjects that you need to go through for AMC MCQ will be medicine. Usually 30% questions come from there. Surgery, gynae ops, pediatrics, psychiatry, and biostatistics or biomedicine. So you can see that there is some percentage, but the software doesn't follow that. Sometimes I have seen that people get 40% questions from psychiatry. So it happens. So it is just an idea, but it's not something that will be absolutely followed in the software. So these are your subjects that you need to follow. Now, let's go back. So our medicine class is divided into all these topics. So as you know that we will take cardiology, respiratory, GIT, neurology, hematology. So all the necessary medicine topics, there are different classes for each of them. And sometimes like cardiology, there are 3 classes, actually 4 classes, respiratory 2 classes. So it depends on how vast they are. There will be more classes on it. For medicine, the main guideline that we will follow is therapeutic guidelines. That's the most updated guideline. You do not need a subscription for it. John Murtagh, very good. So that will be also, we will add that in the theory. You do not, so some of you will ask me, I'm sure today, that do I need to go through John Murtagh? Do I need to read the full John Murtagh by myself? No, you don't. Because in the note, everything that is important from John Murtagh will be added. So sometimes I might ask you to read few topics from John Murtagh, that you need to do it, but most of them will be in your note. Same with the therapeutic guideline, the important topics will be included in the note. So you do not need any of this subscription. We also follow the RSCGP guideline. It's really, really good and important for exam. So that will be covered. There are questions that come in the exam from screening, like colon cancer, breast cancer, prostate cancer screening, cervical cancer screening. For any screening related question, we do Red Book. That's also from RSCGP. The first aid AMC lecture note will be your most important guideline because that will include everything that is needed for that particular subject or topic. Then usually you do some question solve from a QBank, and QBank, we will discuss about that in the course. It's very easy to get it. So you just need to, after you finish a topic, like you finish cardiology, once you finish it, you go through some of the questions from a QBank to know that is your theory knowledge is helping you to solve these questions. That's how QBank works. Surgery. For surgery, this is mainly the topics that we follow. So trauma, gen surg, then IENT, and orthopedics. Most of these are in John Murtagh. We also follow Kaplan Step 2 CK for surgery. That's USMLE Kaplan Step 2 CK. And this is a very good guideline, Trauma Victoria guideline. That's for trauma, we will follow that entirely. Emergency Australia guideline, that's also really good for anything related to emergency like flail chest, open sucking chest wound, pneumothorax. These are very good in these guidelines. And lecture notes are there as well. Pediatrics, a lot of things. So pediatrics and medicine usually is one of the most vast subjects that you will need to finish. So pediatrics is quite vast, and definitely medicine is really, really vast. So these two are going to take you a lot of time. But good thing is pediatrics is very concise and well written in John Murtagh and RCH. These two has everything that is needed for pediatrics. You do not need to go to any other guideline. Psychiatry, we follow mainly Kaplan Step 2 CK. John Murtagh has got a little bit. UWorld, USMLE, that's one of the psychiatry QBank. We will cover that. And lecture note will have almost everything for psychiatry. I'm very, very good with psychiatry, so you do not need to worry about psychiatry at all. Gynae and obstetrics. Gynae Ops, John Murtagh has got most of the topics. We also cover from Kaplan. SA Health is the guideline that we will cover, like RSCGP for medicine, RCH for pediatrics, and SA Health is for Gynae Ops. And there will be others like statistics, ethics that will be covered anyway. So this is a bit of an idea about the topics that we are going to discuss in theory classes. Okay, a lot of topics, but one by one we will cover all of them. Once we do a particular topic, let's say we finish cardiology, we also do this theory-based question solve, which means you will get one of them in the pre-2-week session. Let's say we finish cardiology. Once we finish cardiology, we will include all the last 1 year cardiology related questions, and then we will do that in a class. So it's kind of like a combination of all cardiology related questions in the last 1 to 2 years, and we try to solve them after the cardiology. Okay, so that's what we call theory-based question solve session that I normally take. And then after you have done that, you can go into our student portal and you can appear the theory mock exam, which means we have cardiology mock exam, respiratory mock exam. So there are so many mock exams. So only on the topics or theory based, we have 40 mock exams in the portal. Okay. So that's about theory sessions. Then we have these recent question solve classes, which is like, you call it recall, but we call it recent question solve class. So these recent question solve classes are really important. This gives you an idea about important questions, important topics for the exam. So you get 40 classes as a live session with us. And then there are so many previous batch recorded sessions as well. And also we have currently 80 monthly mock exam available on the portal, and it always gets added. So every month we add more and more. And then we have 5 grand mock exams. So grand mock exams are full exam, which means 150, just an exam like mock exams. Basically, grand mock tests are entirely similar like your AMC exam. This gives you a AMC exam feeling. I normally say that you can do one grand mock exam initially before in your preparation, but do not waste this grand mock test. So at least the last 2 to 3, keep it before your exam, okay, or at least before you feel like you want to go for your exam. So Grand mock tests are super important. That gives you an idea where your preparation is. Are you like confident enough to go for the exam? Even sometimes we say that if you are planning to register for the exam, then please do one of the grand mock tests. You will have a good idea that where you are at the moment. So as I said, that exam week questions solve. So this is added. So exam week question solve for this year, we will focus on November exam mainly. But again, from next year, we do not know yet how we are going to plan it. Next year, it can be every month. We might be doing this exam week question solve, but for this year, it is mainly for November. We're still planning it for October, so it's most probably will be October, November when we will do the exam week question solve sessions. Remember, all the live sessions are recorded, so if you miss any of our classes, the recording will be available, and it's not available only for a few days. It's available for the entire duration of your subscription. So we have 10 months and 15th month subscription option. If you choose 10 month, all the materials, including the video recordings, will be there for 10 months. If you choose 15 months, then it will be 15 months. There is no extension available. That means if you want to extend your subscription after 10 months, that is not available. And you get 150 CPD hours from us. And that is also, remember that there are two ways, and this is where a lot of people get confused. CPD has nothing to do with your exam. If you do not have CPD, you can still go for exam. CPD is related to your job application. Very important. You do not need CPD if you have a recency of practice, which means if you currently work. So if you are working in a hospital or now research is not recency, remember. If you are working in a research setting, or if you're working as a lecturer or a pathologist, that is not a recency of practice. You have to either work as a general practitioner in a clinic or in a hospital setting. That is the only thing that will be included. So if you have recency of practice before you apply for the job, you do not need the CPD. But someone who is in Australia, right? So right after finishing the internship, you got married and you came to Australia with your husband or wife. And then since then, for the last 3 years, you are not working. So for them, what can be done? For them, you need to have this CPD. So every year, at least make sure that you get 50 CPD, and that way you can cover your recency. Again, this is only for job, not for exam. Okay? As I mentioned that for each year, if you do a course this year, you only cover the CPD of this year, not the next year. Previously, people could do that. For the last few years, it's not possible anymore. Now, next thing, that when you try to register for the course, you will see there are 4 options available. And a lot of you ask questions related to that because it is a bit confusing. I get it. So I want to just give you an idea that how it means. First of all, when you see those four subscription options, find out, do you want a CPD certificate from us or you do not want a CPD certificate from us? That is the first question you ask. So do you need a CPD certificate? Who needs a CPD certificate? Who is not working or who has a significant gap this year? That's the first question you ask. So if you do not need a CPD certificate, then you choose the option which does not give you CPD certificate because that is a bit cheaper and affordable. Now, why giving a CPD certificate a bit costly? Because it is costly for us to give you a CPD certificate and to maintain the standard of being a CPD accredited course in Australia. Any of you who is in Australia and you are a member of any of the CPD home, you know that to become a member of CPD, it costs more than $500. Okay, but we are giving you the certificate in a much lower cost. So that's why if you need a CPD certificate, then you choose the option which gives you the CPD certificate. If you do not need a CPD certificate, then choose the one which does not give you CPD certificate. Now, if you are a member of any CPD home, like let's say RECGP, ACRAM, and there are lots of CPD home available in Australia, then you do not need a CPD certificate from us. You can just self-record the classes that you're doing with us. So let's say you're a RSCGP or ACRAM member. In that case, you do not need a certificate from us. All you need to do is just add all the classes that you're taking with us, and you will get CPD hours from RSCGP. Does it make sense to everyone? I hope I made it clear. And if not, then we will again discuss that during the registration pathway class. So if any of you want to register for the course, so how to do that? So first of all, you can just write firstaidamc.com.au and then click it. So you'll find out this is our website, and this is the new website. There is a past website. Please do not go into that. We do not use that website anymore. The website and the student portal has been updated in the last 1 year entirely. It's really good. It's very well structured, and is very user-friendly than the other one that we used to use before. So once you go there, you will find out this is your course, 5 months extensive MCQ course. And if you want to know more about the course, then you just click on the check info, and you can read through everything that I have discussed here. So a lot of things, and most of your questions will be answered here. These are the 4 subscription options you can see. Okay, so go through that and you will find out. So there are option of 10-month and there are option of 15-month subscription. So you can choose either one of them. And then there are option where you can get a CPD certificate from us. Okay, so if you need a CPD certificate, then you choose either option 3 or 4. All right, that's mostly it. Now, if you want to register, then you click on this register now button, and it will take you through number of pages. So first, it will ask you to use your email address, and you will need to use a one-time password, which will be sent to your email, and then it will ask your details and everything. Okay, so that's how you register, and you register. So you make the payment through the website, and then you will contact with us. You will get multiple emails after the payment. If any of you are waiting to get access to the portal, usually our admin goes through that every day. During the admission time, it takes several days to get the access to the portal. So if you have been waiting for more than 2-3 days, then you should send an email to us that, look, I have already paid for the course. I haven't got access to the portal yet. Can you please look into that? Okay, but most of the time, we do give access on a timely basis. But during the admission time, there are hundreds of students we are talking to every day, and we are also trying our best to give access. So it can get a bit backlogged. Please do not lose patience with us for those kind of things. But again, if you are not sure what to do, there are support admin available where you can even give us a call. So this is our email where you can contact us through email. If you're in Australia, you can give call in this number, but there is an hour, so do not just call at any time. So Monday to Saturday, 2 p.m. to 7:30 p.m. Sydney time. This is our admin. So she will be able to answer most of the questions. Do not ask questions related to MCQ because she will not solve MCQ for you. She's an admin. But any course related queries, you can also give a call in this here. If you're overseas, you can contact through this WhatsApp number. Okay, so there are multiple ways to contact with us. If you are not sure what to do, contact. Do not just sit and think that, oh, what's going on? I've paid for this course, nothing is happening. And after 3 months, you come back and say, look, I paid for your course 3 months ago, but I haven't heard from you. Do not do that. It is also your responsibility to talk to us. Okay? Great. We talked about all of this. That questions. Do you guys have any questions about the course? And you can also unmute yourself now if you want. Please do not ask questions about registration pathway.
Okay.
Hello, excuse me.
Can you hear me, sir?
Yes?
Hello, sir. Okay, this is Dr. Eze from Nigeria.
Yeah,
Okay, can you hear me, sir?
I can hear you.
Hello,
What's
can you
your
hear
name,
me?
doctor? What's your name?
Dr. Mine from Nigeria.
All right, Dr. Mine, I can hear you. What's your question?
Okay. My question is, actually, we registered for this course sometime in May, but they sent a text message to us that the course won't be continuing until September or thereabout. So we got an information of this particular webinar that is going on now. So my question is, how is this course going to benefit those of us that has already registered for the examination for November exam? How is it going to benefit us, like the course duration?
All right. So first of all, like if you have already joined the course in May, you should have got access to all the materials. So you are already not a beginner anymore. So you should have listened to all the theory recordings that has been added in the portal for you. So that's the first benefit that you have already got. The second is we have started the course already now. So what you can do, if your theory is finished, you really do not need to bother about theory anymore because theory will not be highly changed. If you want to come and do the live sessions for the theory classes, that's completely fine. It can be used as a revision for you guys, especially for someone who finished watching the recordings already. And the second, the main thing that will be helpful for you is to get those recalls. So we are also doing the question solve sessions right now. Okay, so those question solve sessions will be really helpful for your exam in November. So that's mainly where your preparation will be. You should have finished your theory by now, and these few months that you have got, you should cover all the live session that we are taking. You will definitely finish those, and also the past recalls that we have added in the portal. That also you need to finish. So everything is in the student portal. If you can finish all of them, definitely November exam is not a problem at all.
Hello, sir.
Hello.
I have a question.
Good afternoon, sir.
Yes, Dr. Batul.
Okay.
So I'm sorry, I missed the part where you mentioned the CPD part. If I need the CPD points, I will have to go for either option 3 or 4, and that first aid will be providing for me, right?
Yes, we will give you a CPD certificate covering 150 CPD points.
Okay, so that's like option number 3 or 4. And are you willing to answer questions regarding the exam registration, or that is covered in the other section? I just have questions regarding the ID documents.
ID documents, we will have a discussion in the orientation session. Batul.
All right. Okay. Thank you. Okay. Thank you.
Thank you.
Good, doctor.
Hello.
Good afternoon, sir.
Yeah, Jeffrey.
Yeah, good afternoon, sir. Thank you very much, sir. I'm sorry, sir. Do they have questions on basic sciences? Because when I go through the eMedicine app, I do see questions on basic sciences.
Don't do that because those doesn't come in exam. So
Okay,
physiology, biochemistry, even if,
yeah.
don't worry about those.
Thank you very much, sir. Thank you very much, sir.
Hello, sir, doctor. Hello.
Yeah.
Sir, I'm currently doing my internship and it will be completed by February 2027. So, sir, my question is, sir, when do you think would be the best time for me to prepare the exam for AMC?
So is your internship gonna finish in February or you are starting internship?
It will be finished on February 2027, sir.
Okay, so you should start your preparation now. I finished my AMC Part 1 during my internship. So it is your time. So do that. So you should start your if you are going into AMC, then start your preparation. It doesn't matter whether you have internship finished or not, because if your internship doesn't get counted for appearing the AMC exam. Because all you need to provide to them is AMC certificate, your MBBS certificate. If you have MBBS certificate, you can appear the exam.
Okay, sir. Thank you, sir.
Hello, sir.
Yes, Parijat?
Is there any installment available or not, or the deadline for the subscription?
There is an installment
upcoming
available for, yes, there is an installment available. And so you can pay 60% now and 40% after 6 weeks. The only disadvantage with installment is that you do not get the full access to the course. So there will be a restricted access. Only the live classes will be added in the portal.
Okay, and the deadline of this course?
There is no deadline. You can join the course anytime during the course. But again, we advise that you join as soon as possible. Try not to have a gap, because if you join in the middle of a course, it is difficult to catch up.
Okay, I got my point. Thank you.
Thank you.
Hello, sir.
Hello, sir.
Yes,
I
Ismail.
got so my name is Ismail Hussain. Actually, I joined for my wife. She just completed her final year. She just completed her exam and waiting for her result. So, can she join this course now?
She finished her final exam, right?
Yes, and waiting for her result. Maybe she'll get her result by the end of this month.
Yeah, that's fine. So just provide the certificate of her MBBS, the final exam one at the end of the month. She should be able to join. Just explain to the admin, because admin can be fussy about it. Explain to her, to the admin, that this is the situation and this should be fine.
Okay. So she can join from the starting,
Yeah, she can.
and when she get the result, she can submit it, right?
Yeah. Just
That's great.
explain the admin that this is what happens, and just tell that you will provide it at the end of the month. Okay.
That's very good. And one more thing, I was trying to email you, but AMC, first aid AMC, but didn't get any response. Maybe
Mhm.
maybe I
When
got
was
the
that?
wrong email address. A few weeks ago, like two
Check the
weeks
email
maybe.
again. Check the email again if it is the right one. We get a lot of people who send to wrong email address, or sometimes it sits into our junk or spam folder. That can be another thing. So if you haven't received any queries, then one other quickest way would be to go to that WhatsApp number. That's usually admin always sit on that WhatsApp number. So it is one of the fastest way to get.
Okay. And as I am living in Australia now, so I can directly call
Yeah,
to
you can directly call.
that number. Right?
Yeah.
That's fine. That's fine. Thank you so much, sir.
Thank you.
Hello, sir.
Hello, sir.
Yeah, go for it. I don't know what's your name.
Yeah.
Your name is showing Lenovo.
This is Dr. Nadia.
Nadia. Okay.
Ahid. Yeah, I enrolled this course from June. So I fully take the subscription. So how long, 10 months course will be how long extended?
So
This will
we have
end up
given
to
like
March,
yeah.
or for
So
the
those
2
2
months
months is
extension I will
extra.
get
Those 2 months will be extra.
extra.
So yeah, so you
So I
basically
got
will get 12 months.
access 12 months. Yeah. Oh, thank you. Then another question. So if I take the 10 months course, uh, what will be very beneficial for me when I can sit for exam?
Depends on where you are.
Uh,
There is no specific way to say that. When your preparation is 70%, you are ready for the exam.
70%. After
Okay.
completing my 70% preparation.
Yeah.
Okay, thank you.
Hello, sir. This is Dr. Jasmine. I wanted to ask that, hello?
Yeah, Jasmine, go on.
Yes. Sir, all the guideline resources that you mentioned while you were explaining about the subjects, we don't need to go to the official websites. Everything will be condensed in the theory material.
Yes. Yeah. It will be
Okay.
condensed. And like most of the things will be discussed. So it's a combination. Always remember that some topics the recall mentors will discuss a bit more. Some topics I will discuss more. As a combination, everything will be covered.
Oh, okay. All right, sir. Also, sir, I'm working in a government setting, in a small hospital in a village. And do I need a CPD hour certificate for that?
No, if you are
As a
working, you do not.
journalist, I'm working.
It is a hospital, right?
Yes, it's a hospital, government accredited
Yeah.
hospital.
Yeah, that's better. You don't need a CPD.
Oh, okay. All right, sir. Thank you so much.
Hello, sir.
Yes,
I'm
Luna.
Dr. Luna. So I'm doing MPH in July intake in University of Wollongong. So I would like to take the course that is which is the first option, the 10-month course. Should
Yeah.
I go for the CPT membership or like that?
You should, because the thing is that MPH will not be covered. So MPH is not
Okay.
counted as a recency of practice.
Okay, sir. So the fourth one is suitable for me. That is the 150 points certificate.
Yeah, 3 or 4. I think the third is you get 10-month subscription, and the fourth is you get 15th-month subscription.
Oh,
but I believe
sir.
both of them,
Thank you,
gives you the CPD certificate.
Okay, sir. I would like to see it if I prepare myself very well. That is in March or April. So I
That's fine.
think
Yeah, you've got a good amount of time. At least if you have 6
Yeah.
months time, and again depends on how much time you will need to give you for your MPH. But MPH is from June, right?
July
So you've,
intake from
so you've got a good
2026.
amount of time. Yeah, that's a good idea. So you've got like a good time duration in between. So finish your exam before June.
Yeah. Okay.
Okay.
Okay, sir. So, four of it, third or fourth option will be best for me.
Yes, definitely.
Yeah. Yeah. Thank you, sir.
Yes, Rathin.
Yeah, good evening, sir. So my question was, you said the CPD points, they count the CPD points only for that year, the CPD points. So on that year,
Yeah.
that is eligible. So this course being 10 months of duration, so will it be given CPD points for 2026 or 2027?
Because the course started on 2026, and we will
Okay.
finish the course, like the basic course will be finished this year, 30th December.
Oh.
Okay, it will be
Okay.
2026 because we are not taking any live session in 2027. It's just the access of the course.
Well, and when is the intake of students next after this course?
Next batch, we haven't got any specific date yet, but that will be most probably middle of January. That's when we will start.
Oh, thank you.
Hello, doctor.
Yes, Jubaida.
I have, yeah, I'm Naveen Tahir.
So I would like to ask, like, once we purchase this course, so we'll be able to log into the, like, if I'm sometimes when you're using phone and sometimes you're using a laptop, so like I have to log out and log in every time, or like, or do I have to ask for a permission that, only one device is subscribed, you cannot use in any other device, so something
Only one.
related to that.
Only one, Jubaida, because there's a lot of people who try to abuse the course material, and you might have seen it
Right.
in various groups. Because you guys are paying for a course, and we want to keep the standard for the course so that it doesn't go to people who are not a student. It is available
Okay.
only for one device. So when you are first time logging into the portal, use the device that you want to use for the rest of the course.
Okay, right. And one other thing, like you have your own Q bank, which you have to do.
It's not our
with
own
the
Q
course?
bank. So basically the
Okay.
Q bank, so we get like students who does the course share Q banks, like a lot of Q banks that is available. They share the PDF of it, and you will also get it in, not as a part of the course, but usually students share it. So our Q bank is basically all those 400 classes that we have mentioned, so that we use as a Q bank. So you have got like all the solved question of the last 5 years in the portal. That is our Q bank, but you also get like a lot of students get to share those Q banks PDF
Okay.
Q banks, and you can always get that. It's very easy to get.
Okay. So like if classes are starting from 14th of August. So what days you will take the classes and what would be the timings?
So class is always 7:30 p.m. to 9:30 p.m. Sydney time. That's always the case. The days, I always have a set days of class. So my class is always going to be Tuesday and Friday. But because the recall or the question solve classes are variable, so most of the time it is on Saturday, but sometimes we might need to add one more class in that week that will be given as a schedule. So you get a 1 month schedule ahead, so you will be able to know when we are taking the classes. But as a common idea is Tuesday, Friday, Saturday. That's usually the class.
Okay. And like though you mentioned that first 2 weeks, the classes will be free. How, if one has not yet subscribed, how they're going to able to access it through your Facebook group?
Facebook group. So we will give you, just like how we have shared the Zoom ID for this class, so we will share a Zoom ID for those 2 week sessions. That will go on the Facebook group.
Okay. Okay.
Can
Okay.
you please share the name of your
Hello.
Facebook?
This
Some
is
of us
Are you
are
getting
not.
me?
Can I ask the question, Doctor?
Yes, Jubaida?
My question is related to subscriptions, as I'm going to take the subscriptions, perhaps like one, but my question is related to CPD certificate. As I came to know from your conversation, the CPD is directly related to during the job applying time. So if I go for the subscription like for now, and I don't know when it will be possible for passing the part one. So my question is, can I get it later or separate
No.
with separate payment?
Good question. No, you can't. So usually, like the thing is that each year, so we are as a legal way, we are supposed to provide you the CPD certificate this year. But let's say that you did a course in 2026, and in 2028 you're asking for a CPD certificate for that course, and you did not pay for it at that time. There will be additional payment on it. So it becomes like a good amount of additional. So I think almost double than what you are paying right now. So that is the only problem. You can get it, but the thing is that you'll be paying more than normal.
Okay. That's my question. Like whether there is any other options, because I can guarantee that which time I will pass the exam. That's why I'm asking this question. Okay, thank you so much. That means like we can get, but we need to pay separately or more amount.
Yeah.
Okay. Yeah. Thank you.
Hello. Are you getting me, Doctor?
Yes, I can. Dr. MM?
Okay. Yeah, the thing is, this same question last person asked, but the thing is, I have not been attached with any clinical job for the last 3 years, and I haven't registered for the AMC one yet. So I'm planning for it. Now I have a question about CPT. Is if I join a CPT included course right now, so it will be providing me the certificate for the next 1 year. And within that 1 year, I have to go for the job application. Otherwise, it will not be valid, right?
No, not for next 1 year. It's for only this year. So the course that you do in a specific year, you can only add CPD in that particular year. Means that if you do a course, not just our course, any CPD accredited course, if you do it in 2026, that course will cover for that year, not for next year. That's the Australian
if I attempt to sit for the exam AMC 1 for the next July, so it will be good for me to look for the CPD points onwards, right?
No, got it wrong. So the first thing is exam doesn't have anything to do with CPD. CPD is only for work. If you're applying for a job, then you need CPD. For exam,
Yeah,
CPD has nothing
that's
to
what
do
I
with.
mean, doctor. If I apply for job after passing the AMC 1, that time I will need the CPD, right?
Yes.
But if I look for the CPD points right now, that I will not be getting that on that time.
You can get it, but you will get it for 2026, not for 2027, because you did not do a course
right?
in 2027.
Yeah, right. Okay, thank you.
Hello, I want to ask if my exam is in March. So if I'm taking this session, will I be able to get recalls for February?
Not for this, not under this course, because this course will be finished in December. But you can join our question solve course, which will start from January again.
Okay, and I have graduated in 2021. Since then, I am working as I'm doing a private job in Pakistan. So do I need any CPD certificate for getting a job in Australia?
Are you currently working?
Yes, I'm currently working in a private hospital.
So if you're currently working, there is no need of any CPD.
Okay. Moreover, I am starting it from a scratch. So your lecture and notes are enough to pass the exam, or do I need to take some extra classes?
No extra classes needed.
Okay, thank you, sir.
Okay, it will be more than enough.
Hello, sir. Dr. Nimra here.
Yes, Nimra?
Sir, I have two questions. First of all, I have already purchased the course in the month of July without the CPD hours. So is there any way that I can additionally pay to acquire
Yes.
the CPD hours?
Yes, it is still available. So you can always just ask the admin that you want to pay for the CPD certificate, and she will do that.
All right, thank you, sir. My next question is, for example, if I am sitting for the November exam on 21st, so let's say there are already other exams on the previous dates, like 14th and 15th November. So will the recalls from those dates be updated as well?
If you are going for end of the month, yes, it will. But if anyone goes for exam in, let's say, first week of November, then we will not be able to cover those ones, because we will not even get the recalls by that time. But 21st, yes, we should be able to do some of those months recalls.
All right, thank you, sir.
Thank you. All right, guys, that's it for tonight. I know you still have got a lot of questions. I actually wanted to start the psychiatry today, but then I thought, like, if I start psychiatry, I'll not be able to even do one topic, like not even be able to finish depression. And then it's not actually a class then. So that's why I just thought, like, I would answer some of your questions, get a start, and then from next class, we can just really start the course and classes. Okay. So please join us in the next 2 free week sessions. Get to know about how we take our sessions, get to learn about AMC MCQ, even if you don't want to do a course, know about those topics, because these classes are high yield classes. And we discuss a lot of important things in these sessions. Join us, enjoy those classes, ask questions, and get some benefit. Okay? I'm sure you will love it. And thank you so much for your active participation today. It's really good to see that you guys are interacting. You guys can ask questions. That's one of the things. There are a lot of time we see that candidates don't want to ask questions because they feel shy to ask. So very good. So I'm sure we will have good time ahead. And if you already paid for the course and you have been already enjoying the portal, please make sure that you keep it up. Continue watching those recorded sessions, finish your preparation, because those recorded sessions that we have given you access, they have all the updated materials already there. On the top of that, join the live sessions that we are taking, and it will just become your revision. Okay, not a bad idea at all. The next class is on 14th of August, next Friday. I'll give all the schedule by tonight, so you'll be able to see all the classes schedule of the next 2 weeks on our First Aid AMC MCQ Facebook group. If any of you are not in our Facebook group, that's where we update everything. So please make sure you join this group, First Aid AMC MCQ. In here, I will upload the schedules and all. Okay, and this is where usually you get all the updates, everything about the course. And you can also scroll and you can see that 4 hours ago, this candidate has shared her feedback. She has passed her exam. And if you go through it, you will see a lot of students share their experience with us and their experience about their full exam preparation. Read them. It's really motivational. Okay, and you will get that energy that you need to pass this exam. Because sometimes what happens that you feel alone in this journey because not a lot of people appear the exam. And if you are in a country where they don't know about this exam, you feel like all alone. So you will get to know or meet a lot of people who are doing the same thing like you in the course, and you will be able to make some study buddies. And that will be also like it's an important thing to have some people around you who are doing the same thing. Otherwise, you can't just do it alone. So that's important. And also knowing that people are passing this exam, people are getting job, that also gives you motivation and strength. Because without this, you are just doing something which you don't know if you have any future. All right. And that's why you have got these kind of questions in your head that what am I going to do with my work? Am I going to get a work or not? Am I going to waste all this time for an exam where I don't know what's going to happen to me? So I know from where these questions are coming. But again, I will talk about all of this in a session. You will understand much better about the pathways, where you will be in the next few years, how to be there. So I will definitely guide you about that. Okay. All right. That's it for tonight, guys. Thanks a lot again for your active participation. We'll talk soon. Take care.